Good morning, doctor. First and foremost, thank you for giving me this opportunity to present my assignment. My name is Wen Jie. Today, I will be discussing the cardiovascular system, an essential component of our body that keeps us alive and functioning. I will cover its main parts, namely how it works, and touch on coronary artery disease, including its development, diagnosis, and treatment. Let's begin. What is cardiologist? Cardiologist is a doctor who specializes in diagnosing, treating, and preventing the disease and condition related to the heart and blood vessel. They are expert in managing heart-related conditions from minor arrhythmias to life-threatening heart attack. What is heart? Heart is a muscular organ located in the mediastinum. The heart lies between the sternum and vertebral column from the first rib to the diaphragm and between the lungs. It is roughly the size of a fist, weighing about 250 grams in females and 300 grams in males, approximately 12 cm in length, 9 cm in height at its widest point, and 6 cm in the thickness. Structurally, it's four chambers, two atria and two ventricles. Each chamber has a specific role in ensuring proper circulation. Okay, pericardium. This is to protect the heart against the sudden overfilling. Pericardial fluid. This is the fluid that reduces the friction between the layer of the serous pericardium. Epicardium, and this is a protection layer, outer carving and secret serous fluid. Myocardium contract to pump the blood from the heart chambers. Endocardium form a protective inner lining of chambers involved. Right atrium is receive blood from three veins: superior vena cava, inferior vena cava, and coronary sinus, and pump to the right ventricle. Right ventricle is receiving blood from right atrium and pump it to the lung through the pulmonary artery, pulmonary trunk. Left atrium receive the oxygenated blood from the pulmonary vein and pump it into the left ventricle. The left ventricle that pump the oxygenated blood from the through the aorta to the whole body, and fibrostenoton is prevent the overstretching. Atrioventricular valve, AV valve, is allowed the ejection of blood from the atrium into the ventricle, and semilunar valve allow the injection of blood from the heart into artery. Both of the blood valves that prevent the backflow of the blood into the atrium. Okay, the conduction system of heart. The heart electrical activity starts in the sinoatrial SA node, which is the passing pacemaker, the general impulse that causes the both atria to contract, and the impulse that move on to the atrioventricular node, AV node. This is slightly delayed, which is to allow the blood flow from atria to the ventricular clearly. Okay, then the signal travels through the AV bundle, which is a bundle of His. Now the bundle branches and into the Purkinje fiber and spread through the ventricle, causing the both ventricle to pump, and the blood can pump through to the whole body or to the lung. Okay, heart sound. Heart sound produces the distinct sounds which should be recognized as loud and dark sound. Loud sound of S1 occur when the atrioventricular valve close during the contraction. The dark sound of S2 happen when the semilunar valves close during the relaxation. The S3 and S4 sounds from the blood turbulence during the ventricular filling and atrial systole are usually too quiet to detect. Development of heart. Actually, the heart system, the cardiovascular system, is the first system that developed from in the embryo. From day 18 to 19, the heart being to form from the mesodermal cells. And day 21, the endocardial tubes that fuse into the primitive heart tube due to the embryo folding. Day 22, the primitive heart tube from 5 regions: sinus venosus, primitive atrium, primitive ventricle, bulbus caudis, and truncus arteriosus. Day 23, the heart tube elongates. Day 28, the endocardial cushions thicken and divide the single atrioventricular canal into left and right canal. By the end of the week 5, the heart, atria, ventricles, and atrioventricular canal are fully partitioned. Now we want to introduce the artery disease. We know that the system is vulnerable to disease. One of the most common being coronary artery disease. This condition occurs when the coronary arteries which supply the blood to the heart become narrow or blocked due to the build-up of the atherosclerotic plaque. This blood forms from the lipids, inflammatory cells, and fibrous tissue that can block the blood flow, depriving the heart tissues from oxygen, especially during the increasing activity. Okay, you can see the picture. This is the normal coronary artery, and compared to the atherosclerosis, the lumen will become smaller because they're blocked by the plaque. Next slide. What is atherosclerosis? This is the thickening and loss of the elasticity in artery wall, and is narrowing them and restricting the blood flow. And this is how it comes from. This is the excess low density lipoprotein LDL accumulate in the artery wall. LDL undergo oxidation, causing protein to bind to sugar. Then the T cell join, releasing a chemical that intensifies inflammation. The atherosclerotic plaque formation. And finally, the foam cell, macrophages, and T cell form a fatty strand. This is the early stage of the plaque. Okay, this is the symptom. Angina, chest pain, they feel like heaviness, tightness, or pressure, or burning in the chest. The shortness of the breath occur when the heart struggles to pump enough blood to the body. Heart attack is caused by the fully blocked coronary artery and increasing the pressure and cause the chest pressure, and heart attack might occur. Diagnosis. Okay, echocardiography. We use that like ultrasound wave to creating moving images of the heart. It helps to assess the heart size, shape, and chamber function, blood volume, and velocity. It's used by the electron beam computerized tomography, EBCT. You can see the picture. Next one, the stress testing. Exercise stress testing. We use the physical activity using a treadmill, and the blood pressure is checked. Non-exercise stress tests also be used for the patient unable to exercise. And radionuclic imaging. We can evaluate the blood flow through the heart muscle and can be used in both exercise and non-exercise stress tests. Next one. Treatment. Okay, medication, we can use the antihypertensive, nitroglycerin, beta blocker, cholesterol lowering drugs, and clot dissolving agents, which depends on the disease, what the patient has. Okay, coronary angioplasty. This is like the balloon tip catheter is inserted into artery and guide to the blockage using the X-ray imaging. Then the balloon is inflated at the obstruction that flatten the plaque. You can see the image. Insert, then flatten the plaque against the artery wall and widening the lumen to improve the blood flow. Next. Heart transplant. This is the chest is opened through a mid-sternal incision, and the patient is connected to the heart-lung bypass machine, which is to ensure the oxygen and circulate blood. The damaged heart is removed, and the donor heart is trimmed and sutured in place, ensuring the proper connection to the left atrium and great vessel. The blood flow is restored, and an electrical shock may be used to correct an irregular rhythm. Then, after surgery, patient must take the immunosuppressant drug for life to prevent organ rejection. Okay, this is a doctor I admire, who is Dr. Son-in-law, who got the qualification for DSPN, PKT, MB, Bachelor with, and many. And he is the doctor in Glen Eagle Hospital, Penang. And why I admire him? Because, like, for one reason, because angioplastic surgeons, like, he did the operation successful about the angioplastic operation, and also got many factors. And yeah, I admire him a lot. Okay, in conclusion, the cardiovascular system is a fascinating and vital part of our body, responsible for keeping us alive for circulating blood efficiently. While it is remarkably resilient, it is also susceptible to a condition like coronary artery disease. Understanding its function and vulnerabilities not only deepens our appreciation for it, but also highlights the importance of maintaining cardiovascular health. And thank you, Doctor, for listening to my presentation. I hope it has been both informative and engaging. Thank you.